many hospital administrators that we've been in touch with, even in the really hot spots, you know what they are communicating directly with us that their level of supplies are meeting essential needs. And at the current time, they're really thrilled to be where they are.
Really?
That's just a lie. Nobody's thrilled to be where they are. They've been behind the 8 ball, Mika, from the very beginning, whether you're talking about ventilators, whether you're talking about masks, whether you're talking about gloves, whether you're talking about gowns. Hospital administrators are not, quote, thrilled to be where they are. Another lie from Donald Trump in this, one of the most dangerous weeks we've ever faced.
So as he keeps trying to sort of brand the truth every day during these news conferences, what he doesn't understand is that the world is watching, and that as tens of thousands of people in America die, it's not just the American people overall who are being impacted by this, but Donald Trump, it's your people. Your people are getting the coronavirus. Your people are dying in U.S. hospitals that don't have supplies. So as much as you try and brand the facts every day, the truth is closing in every day.
But I would say that we've said this from the very beginning. The virus doesn't care whether you're a Republican or a Democrat.
You can't control it.
The virus doesn't care whether you're from red state America or blue state America. I mean, there was actually at one point a Republican pollster, Neil Newhouse, who has been known as a loyal Republican pollster for years, actually went and warned Republicans on Capitol Hill that the president and news outlets were giving Republicans bad information that could kill them because they were getting misinformation from Donald Trump and his supporters in the media. That's from a Republican pollster, Neil Newhouse, a loyal Republican pollster, saying they're literally getting information that will cause harm to them and those that they love. And you look at every poll, Mika, that's come out over the past month, and it's Republicans that support Donald Trump that are the most skeptical. Were the most skeptical that this was going to be a pandemic, was the most skeptical from top to bottom that this was going to be the sort of problem that it is because of his lies. He's been lying to the American people from the beginning, underselling this. Other people in the media have as well, and you have been able to see it in polls over the past month.
The president's team, his inner circle, Dan, Larry, Pete, Jared, are they going to tell you the truth, or are they going to tell you what you want to hear? Is there anyone in there?
Nobody's in there to tell him the truth.
Anybody? Really?
He can't stand the truth.
So they don't give it to him.
No,
a new
they
report
don't.
from the government's healthcare watchdog paints a much different picture than the president's alternative reality, quoting hundreds of hospital officials who depict an American health system in crisis, beset by equipment shortages, worried about the safety of their workers, drowning financially, and begging the federal government to do more. The Inspector General of the Department of Health and Human Services interviewed 324 hospitals across 46 states.
By the way, this is a Trump. This is the Trump administration, by the way, doing this investigation. For those of you out there who aren't smart enough to figure that out, this isn't the lamestream media. This is Trump's own administration doing this study.
Granted anonymity to speak candidly, they described a healthcare system laboring under conditions more commonly seen in the developing world. Let's bring in NBC News correspondent covering national security and intelligence, Ken Delaney, and we have got a lot to talk to you about today, Ken, but why don't you start right there?
So, Mika, hospital officials do not agree with the president. They described a healthcare system in chaos. And I have to say, this is one of the most infuriating government reports I've ever read. We've been seeing news accounts for weeks now, quoting doctors and nurses, talking about equipment shortages, dangerous working conditions, and what they say is an inadequate response from the federal government. But this is the first national investigation, as Joe said, by the Trump administration itself. by a federal oversight agency, the Inspector General for the Department of Health and Human Services. And what investigators have confirmed is what you've been seeing in news reports, what people have been saying on your show, on NBC and elsewhere, which is that hospitals are beset by shortages, and they found things that are even worse than what we've been hearing. For example, we've heard a lot about shortages of ventilators and masks, but this report found shortages of cleaning supplies and thermometers. One hospital with 700 staff had only 1 or 2 thermometers to use for screening patients. That's the kind of shortage that puts patients and healthcare workers in jeopardy. And contrary to what the president said, hospitals say the government isn't doing enough. They reported that what they're getting from federal and state stockpiles is not only insufficient, in some cases defective. One healthcare system received 1,000 masks from the government, 500 were for children and so unusable for adults. Another hospital received a shipment of masks that had to be thrown out because it was dry rotted. We interviewed Ann Maxwell, the Assistant Inspector General, and she seemed genuinely stunned by some of what she and her team found. Let's take a listen.
One moment that stands out for me is when I was talking to a hospital administrator, and he told me that he had staff in the hospital out trying to procure masks and gloves from auto part shops, from home supply stores, from beauty salons, from art supply stores. And I was just taken aback by how in that one example, you could see both the desperation of the challenges they're facing and the ingenuity they were putting forward in trying to solve these problems so they could provide good patient care and save lives.
The other aspect of this that they explored is that hospitals are facing a financial crisis because they've had to cancel all the elective procedures that bring in income. So some of them are practically insolvent, struggling to pay bills. And in some cases, insurance companies are not reimbursing them for COVID care. And Maxwell also talked about the financial crisis facing hospitals.
We had one hospital say that their finances were so dire that they were considering the possibility of laying off staff at the exact same time they recognized and knew they needed more staff to address the challenges facing them.
Now, some financial aid for hospitals was included in that congressional relief package, Mika and Joe, but like most aspects of the federal response, it may be too little, too late.
All right.
All right, Ken. Thank you so much. Greatly appreciate that. That's extraordinarily important reporting. And Ed Luce, thanks for checking out MSNBC on YouTube. And make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.